Welcome to the ATC HSSC online training series. In this module, you will learn the principles of wound management and bandaging using a basic first aid kit outside the hospital. We will cover the equipment required, the correct bandaging technique, safety precautions, and common mistakes to avoid. What is wound management? Wound management is the process of assessing, cleaning, and protecting an injured area using appropriate first aid techniques. Proper wound care helps control bleeding, reduces the risk of infection, relieves pain, and prepares the patient for safe transport to a healthcare facility. Why wound management matters. Proper wound management helps control bleeding, prevents contamination, protects the wound from further injury, promotes healing, and improves patient comfort while waiting for medical care. Equipment required. Before beginning the procedure, ensure that all the necessary equipment is available. Wear disposable gloves to maintain infection control. Keep sterile gauze pads, roller bandages, adhesive tape, trauma scissors, and normal saline ready to clean the wound if required before applying the dressing. Keep a kidney tray and bowl nearby for the procedure. Procedure for wound management and bandaging. Step 1. Initial assessment. Before starting the assessment, wear disposable gloves to protect both yourself and the patient from cross-infection. Perform a primary assessment to identify the type and severity of the wound, and check for any life-threatening bleeding. Assess the patient's overall condition, and if the injury is severe or the bleeding cannot be controlled, activate emergency medical services or arrange immediate medical assistance. Step 2. Control bleeding. Apply firm, direct pressure over the wound using sterile gauze or a clean dressing to help control bleeding. If there is no suspected fracture or spinal injury, elevate the injured limb above the level of the heart to reduce blood loss. If the dressing becomes soaked with blood, do not remove it, as this may disturb clot formation. Instead, place another sterile dressing over it and continue applying firm pressure until the bleeding is controlled. Step 3. Clean the wound. Once the bleeding is controlled, gently clean the wound using normal saline or clean running water if available. Carefully remove any visible dirt or debris from the wound. Clean from the center of the wound outward toward the surrounding skin using sterile gauze, using a fresh gauze for each wipe. Step 4. Apply sterile dressing. Place a sterile gauze dressing directly over the wound, ensuring that the entire wound is completely covered. Handle the dressing by its edges whenever possible, and avoid touching the surface that comes into contact with the wound. This helps reduce the risk of contamination and provides protection while the wound begins to heal. Step 5. Secure the dressing. Apply a roller bandage over the dressing, overlapping each turn by half of the previous wrap. Wrap evenly around the injured area to keep the dressing secure. Secure the end with adhesive tape if necessary, ensuring the bandage is firm but not tight enough to impair circulation or cause discomfort. Step 6. Reassess circulation. After securing the dressing, reassess the circulation beyond the injured area. Check the pulse if feasible, assess the capillary refill time, observe the skin color and temperature. These findings help confirm that the bandage has not compromised blood circulation or nerve function. Step 7. Reassure and refer. Reassure the patient and encourage them to remain calm while continuing to monitor their condition. Watch for ongoing bleeding, increasing pain, or signs of shock, and seek immediate medical attention if the condition worsens. Arrange prompt transport to the nearest healthcare facility for further evaluation and treatment, particularly if the wound is deep, heavily contaminated, caused by an animal or human bite, or continues to bleed despite first aid. Common errors to avoid. Avoid touching the wound with bare hands, removing deeply embedded objects, applying bandages too tightly, or using non-sterile dressing materials. Always control bleeding before applying a dressing and reassess circulation after bandaging to ensure patient safety. Wound management and bandaging are essential first aid skills that help control bleeding, prevent infection, and protect the injured area until definitive medical care is available. For more practical clinical videos and learning content, visit www.healthcare-skilling.com. Thank you.